Welcome, everybody. We are still expecting a few more people, but I think we'll get started because time is running on. Welcome to this seminar and webinar that I'm really looking forward to, that looks at how do we recruit the next generation of health educators and academics from diverse communities to ensure that they actually reflect the group and the service users that they are going to be serving. We're really delighted to welcome Professor Calvin Morley. Calvin is a professor for diversity and social justice in the nursing department at London South Bank University. His research focuses on an interplay of gender, culture, race, and health using a social justice lens. Since graduating as an adult registered nurse, Calvin has followed a clinical and academic career, remaining close to clinical nursing, particularly in critical care environments. Calvin developed the Elevate project aimed at reducing maternal mortality via career development for midwives. He's also developed the NIHR funded into research a program for Black and global majority nurses and midwives. And he's developed the Dame Elizabeth Annie Onyu lecture for inclusivity in nursing and midwifery. So really looking forward to hearing from Calvin. Now, we will have time for questions later on, but if I could ask people to use the Q&A box for any questions, I will then field those questions and put them to Calvin. But I'm going to now hand over to Calvin and look forward to hearing from him.
Great. Thank you so much for that welcome, Professor Mohammed. It's lovely to be with you all today. We're just going to wait while Felix loads the slides for us as we go into that mode. But my talk today, while the slides are being loaded, is on developing a diverse academic workforce. And if we go to the next slide, please. Great. So today I will do a few things in this lecture I endeavor to do. I want to very briefly review the statistics on academic workforce, explore the concept of whiteness and how whiteness impacts on intersectionally diverse academic workforces, and provide an overview of how reclaiming narratives, which was the theme for this year's Black History Month, how that can help develop an intersectionally diverse academic workforce. So if we go to the next slide. Some really quick, I always think it's important that when I'm speaking to people, they have a little bit of knowledge of who I am and why I'm sitting or standing in front of them speaking. So I have over 25 years experience of nursing. My background is in intensive care. You will hear from my accent, I'm originally from the Caribbean. I'm from Trinidad and Tobago. So the first photo you see me in my school uniform when I was about 16. The theme here is, you can look at it's my hair, right? I had a huge afro back then. And then the one with me in the scrubs, I really like this photo purely because, not because it makes me look a little bit younger, but because that's when I always work in clinical nursing. I work one weekend every month now, but during the pandemic, I went back to serve full-time in nursing in an ITU. And that's why I love that photo. That was one of the rare days I could have smiled during the pandemic. And it's just to say, I grew up near the seaside. You can see photos of the beach. Growing up in Trinidad, I came from a very poor family and background. I have no qualms in telling people that I went to school bare feet. We played cricket in the road. That was our after-school activities, and that's what that photo is about. Because I lived in the countryside, there weren't much cars driving past by, so you could actually set up, your wicket and have the whole team to play cricket in the road. And Trinidad, we're also known for Carnival. And it's a big festival over 2 days. Normally happens, the Monday and Tuesday before Ash Wednesday for those who are Christians and going into Lent period. Really quickly, part of my heritage is that I'm originally from slave ancestry. So it's really important for me when I talk about racially minoritized people and backgrounds. You'd see where my passion comes from. My family, as slave ancestors, I came from a cocoa and coffee background. So when I grew up, during the summer holidays, we had to go into the cocoa and coffee estate and help work with my parents. Um, and that land was given to us from when slavery was abolished. So my father got what you'd call an olden money as such, 25 acres of land for developing cocoa and coffee as a slave. I say my father, my foreparents really. And that sounds all well and good, but when we talk about reparations, that land was really and truly another 30 kilometers into the forest. It wasn't the best land possible. So we had to use, what we call cattles and develop sleighs or build a sleigh and a yoke for the cattle to carry all the products and everything in and out of, the forested land. But that's what life was like. So, when you hear people say, slaves got their freedom after slavery was abolished and they got land, etc., it wasn't the best. That's just to explain that to you. So we'll quickly move on to the next slide. I work here at London South Bank University, and in LSBU, we're globally across the world. Um, we're ranked third for reducing health inequality or reducing inequalities, not health, but reducing inequalities. And some of the reasons we were ranked third is because we support students with disabilities. We raise awareness for STEM careers for female students. We have some UK first projects, such as our blood pressure testing at barbershops. We did a gap analysis on outcomes for free school meals for students in higher education. And we also, during this, crisis we have of living these days, economic crisis, we run free energy advice clinics through our legal advice clinic here at LSBU. And we help people with things like housing and social care and all these other things. So this is one of the reasons why we rank third globally. So now I'm going to get into the lecture. Okay, I just wanted to set the scene. So thank you, Felix. Um, the academic healthcare workforce. If you Google it right now, it will tell you we have more men than women in the healthcare workforce. But you and I know that there are more women in the general healthcare workforce. In the academic workforce, there's more men. Of those groups of men, 76% are professors and 62% are readers or senior lecturers. So you can begin to see the picture of when we talk of diverse workforce in terms of gender, what it looks like. And if we move to the next slide. So in the UK, on the whole, there's 23,515 professors. And there's only 61 who are Black and female of that group. So if we think of gender in the last slide, and now we're thinking of all the professors in this country in UK universities, it amounts to 23,500. And there's only 61 who identify as Black female. So if we start to begin to look at diverse workforce, we can see we're already starting at a disadvantage. Next slide, please, Felix. So there's an underrepresentation, the data tells us, of women in academic workforces, particularly in the healthcare service, of people with disabilities and of LGBTQIA people. So those are the three main underrepresented groups in the academic health workforce. So again, if you're thinking of having a diverse workforce and what that means, you can see that there's a number of underrepresentation. And for those of you on the call, if you went to the Council of Deans website, you'd see the council did a review last year of health faculties. It's a bit of a dense report, but there's some easy reading in it. And you'll see where, some of my figures and statistics come from, is from that report that was published last year. Next slide, please. So role models are important. It's really important when we look at diversity in the academic workforce that we see people who look like us, sound like us, people who share some of the same practices and beliefs like us. It's really important because, for example, the first time I ever met a Black professor was Dame Elizabeth Anyuonu. I had just started my lecturing career, and I only stayed at that university for a year, and then I moved on because I had a scholarship to do my doctorate. And then the next time I met a Black professor was Professor Laura Sarrant. I was presenting at a RCN conference in Northern Ireland in something like 2012, and there was Laura, and she said she was a professor, and I was like, oh, so Black people can be professors. It took, two people I knew as such, um, to actually tell me, well, okay, yeah, we couldn't be in this space. It's really important, that we look at the other areas such as like disability and LGBTQIA and gender, how important they are for role models. So when I showed you the slide about LSBU being part of, being ranked third in the world globally, we run lots of career to help young girls and women enter STEM subjects. And we have all our computing and engineering and science people come out and actually work with young girls and females as such to try and get them to develop a career in STEM subjects, because role modeling is very important. So next slide, please. So now I've given you some, talking you through this. We've looked at the statistics. We've looked at why role modeling is important. And I wanted to talk to you a little bit about systemic and structural whiteness and how that impacts on our diverse workforce in terms of race. So I should say I speak from a nursing platform, but I acknowledge their AHPs and various, health backgrounds on this call today. So a lot of you would have heard during your training and your reading about systemic racism and structural racism. And I'm flipping it over on the other side to look at it as systemic and structural whiteness. Whiteness is a socially constructed category of race. And within that, non-white people are labeled. So you got to see it as a social category, okay? That's what whiteness is. Immanuel Kant wrote a paper around the different human races. And he had a schema, and he came up with 4 human races. And he really had the whites at the top, and he had Africans or Negroes. I'm using his language, so that's why I say Negroes in there. But he had whites at the top and Negroes at the bottom. And then he called yellow Indians and copper Indians the 2 other races in the middle. So he developed a hierarchy for us. And in some respects, by developing that hierarchy, that's why we've always been pitted against each other. So some of you would see this, and it's something we have to acknowledge, that some of our racially minoritized groups war against each other. So as I said to you, I still practice in nursing, and I see it all the time of how our Filipino nurses, our Indian nurses, and African nurses treat each other differently. That's because we were put in a hierarchical system. That's what whiteness did to us. That's what Immanuel Kant did. So he had his very good contemporary called David Hume. And both Kant and Hume drew on the works of Linnaeus, who was a Swedish philosopher. And if we just move to the next slide, please. Thank you. So in saying that, David Hume and Immanuel Kant, they used to have their little banter as such, and their little academic arguments. And they came up with 4 types. They call them Homo Europaeus, which are whites, and white people are described as civilized and lived by rules and customs. Homo Americanus, which are Native Americans, who are described as tenacious and governed by habit. Homo Asiaticus, which is Asians, described as stern, greedy, lived, and led by opinion. And then there's Homo Afri, which is who are described really as cunning, slow to think, careless, and governed by caprice. If we move to the next slide. So here we have this whole idea of a hierarchy of racism. And then it went on in that previous slide that I just showed you of how we define who is what. And it goes on to say that Europeans were of fair complexion, sanguine temperament, and brawny. They were of gentle manners, acute of judgment, of quick invention, and governed by fixed laws. Africans, on the other hand, were of black complexion, phlegmatic temperament, and relaxed fiber, often crafty, indolent, and careless disposition, and are governed by actions and by caprice, in the actions by caprice. I want to stop there for a moment because you all are students, and some of you would have noticed this, you would have experienced it, some of you have observed it. When I had a scholarship to do my doctorate, which was in, 2008 or something. It was only £12,000 a year, so it's not much. So I used to do agency bank nursing on the weekends. And one of the things I've witnessed, observed, and experienced, this thing of labeling Black people as relaxed fibers, crafty, indolent, careless, and white people as being intelligent and having good judgment, it plays out in our clinical practice. So as an agency nurse, I was always given the patient that they considered difficult, not the patient that needed, because I'm an intensive care nurse, not the patient that needed the skills of a qualified, intelligent intensive care nurse. I was given the patient that they considered difficult. So example, someone who had delirium, someone who was having countless episodes of diarrhea, someone who was on a weaning tracheostomy system. Those sort of patients. I wasn't given the patients which my background is cardiac intensive care. So heart bypass, heart transplant, lungs, that's my area. And you see that even today. I see when nurses come in to do agency, particularly Black nurses, they're given those difficult patients still. The nurse in charge will always come and look at them and check up what they're doing. Not because they're agency, it's because they're Black. Because whiteness has told us that structural and systemic part of whiteness, I told you all about earlier on, it has taught us that Black people, they're not intelligent. We need to keep an eye on them. So if we move to the next slide, please, Felix. Um, Kant shows only disdain for African people. He says here that the Negroes of Africa have by nature no feeling and rises above the ridiculous. And their feelings of beauty remains unconnected to what is noble. So what African people consider beautiful has no connection to what is noble. So think of royalty and nobleness. Think of African people who would have piercings. They would wear, bone necklaces, earrings. They would have the elongated necks. That's their signs of beauty. It was unconnected. But the first bit I want to bring you back to, the Negroes of Africa have by nature no feelings. And here we come back and we see this. You will see this played out. You would have read it. You would have heard stories about it again, depending on where you are in your career trajectory. So me speaking from a nursing platform, about a year after the pandemic, I went, we were still in all those different, waves and phases. I had a PhD to examine in Sheffield. And this young man sat to me opposite the train and he says, so I was kind of dressed up, I was wearing a suit. And he says, "Oh, you look important." And we just started talking. He was of Somalian heritage. And he said to me, he went to get his COVID vaccine, and the nurse said to him, she needs to use a bigger needle because of his skin. So in 2021, this happened. Negroes of Africa, by nature, have by nature no feelings. We've heard of Black women tell you about, childbirth experiences where pain is concerned. We've heard patients on the whole tell you about pain and what they're told by healthcare practitioners. But this is what whiteness had done. Whiteness gave us these categories, and whiteness told us what we were. So Kant refers to the claim of David Hume, because I told you there were two, blokes that were bantering, that says no Black man had ever made significant contribution to the arts or sciences, even when he had acquired freedom in Europe. So it comes back to say that, we're not arty people and these sort of things. If we move to the next slide, please, Felix. So Hume saw whiteness as superior. And I'm reading off these slides because I really want you all to get the gist of what I'm saying. Hume says, I am apt to suspect that Negroes in general and all species of men, for that there are 4 or 5 different kinds, to be naturally inferior to whites. There was never a civilized of any other complexion than white. So this was not based on education. It was not based on intelligence. When racism develops and how we treat people, and this has passed down through the ages, talks about skin color. That the Negroes in general, okay, to be naturally inferior to whites. Because he talks about the complexion, okay? There was never a civilized of any other complexion than white. So Kant decides to, respond to Hume, and they're having their little banter. And these are one of the things he said. He said, we can judge with probability that the intermixture of races caused by large scales of conquest, because remember, England was then going out, or Britain was going and conquering. They were colonizing the new world as such. So they were saying that there should never be an intermixture of the races, which gradually extinguishes the characteristics. It does not seem beneficial to the human race. So they're saying we shouldn't have interracial or mixed race people. If you looked at the last national census for England, mixed race is being reported as one of the top races now. So there have been mixture. Can we move, please, to the next slide? So one of the things I wanted to tell you is Kant and Hume lived here in Britain. And one of those things is that they never, ever set foot outside of England when they wrote those papers and made judgments. The two men had never clapped eyes on a black person. They had never left the country at that point when they wrote this stuff about black people. So here you have two people giving you secondhand information because they base it on the works of Linnaeus. So they read Linnaeus papers and they said, you know what? We're going to form our categories and we're going to tell you that white is really good. So I just wanted to leave you that these two people had never experienced, okay? So I want you to stop and think while I'm saying this. How do you think you have facilitated whiteness and whiteness in nursing, midwifery, and AHP? You as a student who's on a leadership program, how do you think you facilitated whiteness? It's just for you to think. We're going to move on to the next question. Well, a lot of you are probably going to say, not me. Not question, sorry, slide. Thank you, Felix. So there is a benefit of intersectionally diverse academic workforce. So if we reflect on what Kant and Hume said, particularly for us in this country, in the United Kingdom, you would see that there will be the reasons still persist why we do not have, in terms of a racially diverse workforce. And that, if you use race as the common denominator, someone asked me recently, why is it always race? But race becomes the denominator. If you look at the Nursing and Midwifery Council Independent Culture Review, race was the denominator. If you look at awarding gaps for students, race is the common denominator. If you look at health disparities overall and inequalities, race becomes the common denominator. But coming back to, that's why I focus on race. But there's also the intersectionality, because we're not just a black person. We're a black person who is male, female, non-binary. We're someone who probably identifies as LGBTQIA, someone with a disability. So that's the intersections, okay? We come with intersections. So That's why I want to talk to you about the diverse academic workforce we have. So what are the benefits of it, and why? The reason why you don't see a diverse academic workforce is because whiteness pervades. I have been for job interviews where I was told, oh, it was, it's not that you weren't good, you were really good. Um, but it's just on the day the other candidate said something, and I was like, but if you know I was really good, why couldn't you take me on and develop me? You know, and so we always get these answers of why we're not good enough. So we don't have a representative academic workforce that's diverse in terms of race to begin with. It's because we have used whiteness to judge people. Have you ever heard? I've had people say to me, "Oh, you've got a PhD," and they sound really shocked. Or, you speak so well. I still get that. Honestly, I do. So it's really interesting how, it's because of what whiteness has told us. But when we have a diverse intersectional academic workforce, we will enhance our representation, and that group will become more empathetic. They will bring with them all those things I was talking to you about, the intersectional bits, the race, the gender, the socioeconomic background, the disabilities, and all the other identities. And when they become part of the education workforce, they can also empathize with students from that same background. They will look at ways of teaching people, for example, who are neurodiverse because they themselves are neurodiverse. They would foster more culturally competent healthcare professionals, because if we teach students in that way, this diverse workforce, then we're teaching students to also provide diverse care as such. It improves healthcare equity. It helps us to address those disparities by including voices from the marginalized communities. So, we bring people on when we're developing the curriculum. I mean, when we have academics from various backgrounds, we can use decolonization to identify and focus on health issues. So decolonization is a really important point. You would have heard it during your program and in your university. We talk about decolonization of the curriculum. It means this basically the same thing I was just saying to you. How do we remove whiteness from the practice and the curriculum and the literature? So those of you who are midwives, up until recently, we were still saying an APGAR score when the baby is now born, those who have babies. We were still saying, is a black baby pink and well perfused? It's only about a year ago, the RHO, the Race and Health Observatory, Professor Habib Natvi, they ran some research projects, and we concluded that we should no longer be using the APGAR score in England. So these are the things when we have people from diverse backgrounds, these are the changes we can make. Also, the RHO, Race Health Observatory, Professor Nakvi and his team, they also looked at, during the pandemic, saturation monitoring, O2 saturations, how it reads differently on white skin. So these are what people from intersectionally diverse backgrounds, if they come into the academic workforce, these are the things they can bring. If we move to the next slide, please. So some of the other things which I've talked about is cultural competence, health equity, innovation and creativity. It provides an improved learning environment. Look, one of the things I say to my university that we've got very wrong here is that we had new buildings built, and rather than give the rooms names of people in terms of decolonization. So if we had called, rather than call the room, lecture theater 1 and lecture theater 2 or room 3 or AB, if we had given those theaters names of people, it would signal to students that they are in a safe space, a space where they're welcome. So if we, example, called a room the Stonewall Room, people from LGBTQIA backgrounds would recognize that they're welcome there. If we had had a Dame Elizabeth and Wonu, and I know the King's Fund recently named one of their rooms after Dame Elizabeth, it says to people, people of this background are welcome here. We recognize them. So, we need to go out and look at how we can just change some of those little things. Um, People from diverse backgrounds, I always go and lecture to my students. I love research and I love research methods. And some of you will hate research and research methods, but I go out every year and I teach the research year 2 and year 3 research methods program, for 6 weeks for year 2 and 6 weeks for year 3. I'm in the classroom because it's also to be a role model. Students need to see that someone who sounds like me, looks like me, they can role model through me and really enjoy research and aim to become, something like me as such. It also helps us with policy and curriculum development, that whole intersectional diversity influences how our curriculum becomes more inclusive. I was doing some work in Jamaica once, and I said to my colleague, my academic colleague, I said, so, I link up with this group here in Jamaica. They provide HIV support to people in Jamaica. Do you think you should have them on your public health module? I can introduce you. And she looked at me really shyly and she said, oh, I don't think our students are prepared to talk to people like that yet. And I walked away and I thought, it's not the students are not prepared, it's you who are not prepared. And it's really important. Sometimes people blame students, but actually it's if we are not prepared. And in the same way we blame patients, but if we are not prepared, that's why these things happen. The next slide, please. I'm going to finish in the next 5 minutes so we can really have a great discussion. So far I've told you about a little bit about the statistics are, what whiteness is, and what are the benefits of the academic workforce. This year for Black History Month, the theme was reclaiming narratives. So this is some of the work, and Professor Mohammed alluded to this in my introduction, that I did around the Dame Elizabeth. I want you, those of you who don't know, Elizabeth was the first nurse to set up a nurse-led sickle cell outpatient department, or patient department even. Elizabeth, those of you who looked at the coronation of the king, she was the person who carried the orb for the king for his coronation. She's a dame, and Elizabeth has done, several things that's worthy of recognition. I'll just tell you briefly, she's from a mixed race marriage. Her mother was at Cambridge, so she has got a book written called Blessings from a Mixed Union, or a Cambridge Union, I think. Um, I'll tell you really quickly, 'cause I thought it was really funny when Elizabeth shared it with me over lunch. She said, so her mother was Irish and got pregnant at Cambridge University here in England. And once she, got in that way, as it was termed back then, her parents started writing to all the aunties in the countryside in Ireland saying, she's in this way, she needs to come back to Ireland so, she can give birth, etc. And she's ruined her whole career to be a Cambridge graduate, etc. Elizabeth said throughout this whole process, no one ever asked her mother who the father was. So when she was born, all the Irish nuns kept saying, the baby's dusky, the baby's dusky, the baby's dusky, the baby's not pink. But no one had ever stopped to ask who the father was. And obviously her father, not obviously, but to you all, her father was Nigerian. So that's just a little thing to tell you some of the, if you get a chance to read Elizabeth's book, please do. Next slide, please. So in reclaiming narratives, it's really important. Why do we reclaim narratives? Because for me, in my profession, nursing is covered in whiteness. We hear of Florence Nightingale. We don't hear about people like Mary Seacole as much as Florence Nightingale. We don't hear about Sojourner Truth. We don't hear much about people like Elizabeth or Corolla Abeni Pratt. So what I decided is that, I developed a fellowship for inclusivity in nursing and midwifery. And that's a leadership program for underrepresented nurses and midwives. It focused on inclusivity and it offered mentorship, leadership, helping you to develop as a leader. And at the end, the fellows engage in a research and advocacy project to help tackle racial inequalities and health disparities, advancing policy and promote inclusive health. If we move to the next slide, I'm just wary of time. I also set up the annual lecture, which we had here last week at London South Bank University. It was given by Dr. Ruto Shikanlu, which is a platform for really addressing issues related to diversity, equity, and inclusion in healthcare. It brings our communities together. We're very much a civic university at London South Bank. So it brings our communities together, and it serves as an inspiring and educational event for health professionals, policymakers, and public, motivating, people along the way for equitable health. And the next slide, please. And then so what do these do? Overall, also we run the award for inclusivity in nursing, I should say, as well, that encourages best practices in inclusivity, which is around on the borders of our diversity intersectionality, okay? And what do these initiatives do overall in reclaiming narratives? It becomes a comprehensive platform where minoritized nurses and midwives can lead and advocate for equity. So when I say minoritized, I don't just mean racially minoritized. You may be a gender minority, disability, etc., to advocate for equity and influence policy changes. Next slide, please. So in terms of reclaiming narratives, some of the other things that I've done is I went to the NIHR, National Institute for Health Research. I had several meetings with the NIHR, and I said to them, when I go to a scientific nursing conference, I do not see Black people presenting their work because there aren't Black people doing research. So the NIHR has funded a program for us aimed at developing researchers from Black and racially minoritized heritage. Next year and in about March, we put out for applications. Next year, we will extend this to AHPs because our last meeting with the NIHR, we recognize that AHPs also are lagging behind. So that's another way of reclaiming narratives that Black people can do meaningful research. They can engage with statistics. They can think. They're not slow to think, but they can think. We also, some of you who are midwives, you may have heard of the Embrace report. Embrace tells us that Black women are 5 times more likely to die during pregnancy and childbirth. So we developed the Elevate program, which is a career development program for neonatal nurses and midwives. And the reason why we've done that is so that we can equip these staff to advocate for women of their background, give them the career development skills and tools they need to be able to do those things. And hopefully, as they advocate for women, we're also going to see a reduction in 5 times more and more initiatives around health promotion and public health for women and pregnancy. We also run the White Allyship. I also developed the White Allyship program at work for the NHS, which is a program on anti-racism for white people to understand what to do. Because some white people they have the good intentions, but they don't know what to do and they need those skills. So next slide, please. So I wanted to close off my remarks to you. I have 4 points. Is that since the Black Lives Matter movement, there's an urgency to unite in the fight against racism. That fight is waning, okay? People have lost the momentum, so we need that urgency. And therefore, there's a need for anti-racist practice as a necessity for the nursing profession to grow and develop. As I said to you, I'm speaking from a nursing platform, but it also extends to other AHPs. This includes recognizing and challenging whiteness and decolonizing the profession. By decolonizing the profession, having people like me, having people with accents, having people from various backgrounds, we will get there. We will make the workforce more diverse. Leadership needs to rise against anti-racism, and in so doing, provide race security and assurance. So you would have heard and read about food security and financial assurance, etc. Here I'm talking about race security and assurance. So when the riots happened during the summer, the race riots in England, where was the security for our people? What is the assurance there is? So leaderships need to do that, including developing a diverse academic healthcare workforce. That will also help. And finally, one of the lessons from COVID-19 is that transformation can take place in weeks rather than years. Racial thinking needs to be centralized. It's a slow pandemic, which the events of 2019-20 accelerated. 2019-20 showed us that. I would say even, the last big global thing to happen was the American elections. And that also puts us in a position where we need to look at race security, diversity, even. We know how that the elected president, the president-elect, what their thoughts are on women and reproductive rights, things around those areas we need to look at. So, my final thing is that remember, whiteness kills. We saw it in the pandemic. We see it every day. It can kill our professions as well. If we do not have that diverse workforce, then we will be losing a lot of valuable inputs, insights, and things that just make life better on the whole. So thank you all very much. I'm happy to take questions and enter that conversation with you.
Calvin, thank you. That's been a really interesting presentation. We have got some questions in our question and answer box, and if anyone else has got any questions, please do add them. I'll just portray one of the questions to you. It asks, can you say more about how you've been exposed to racism in your academic career and talk more about the importance of role models?
I'm sure. So first of all, I'll say role models. I'll answer the question backwards. Role models are really important. Um, Professor Laura Sarant has been my giant and my mentor. Um, Laura taught me various things, and as a role model, she also took me where she went. So she became a mentor and a coach from role modeling. So if there was a talk happening somewhere, Laura will email me or text me and say, Calvin, there's a talk happening in London. I'm coming because she's in the north of England. I'm coming to London. Would you like to join me? So there are those things. My own experience of racism, they're always traumatic. So I have experiences from when, patients have been racially abusive towards me. I have experiences of in academia. Um, when I was appointed as a professor, a lot of people said, oh, he only got that because it's Black Lives Matter. It was, in 2021, I was appointed. People thought, that's a way of denying you your true value and your worth. Um, I have had racism where, I was stopped twice during the July 7th bombings. I I was stopped twice between Liverpool Street Station in London and Stratford, where I was doing my PhD, University of East London. On both train platforms, I was stopped twice. In the middle of the train station, I had to put my hands up in the air like this, take my rucksack off, and I had to say to the man, well, how do I take my rucksack off? Are you going to shoot me if I go to take my hand off? Take my hand down? And because they thought I was a terrorist for some reason. I used to have a big beard then as well, so I guess they profiled me. Um, but those are some of the experiences. Twice in one day. When I said to them, look, I was stopped at the other station. Here's the paper they gave me. They said, no, we need to do it again. And while I was kneeling at Liverpool Street in front of everyone, people walked by and spat on me because they thought I was a terrorist. And we know that comes with Islamophobia and everything else. So those are just some of the experiences I've had. But role modeling has really helped me. Okay. I am the only male professor of nursing from the Caribbean in nursing in this country. So I haven't really had male role models in nursing, but female role models I've had. There's also Professor Udwak Achibong at Leeds. But yeah.
Thanks, Calvin. Another question. Can you suggest how students can work together to address barriers to participation?
I'm not sure what part in terms of participation.
So yeah,
So
it's about participation, I expect, in, I suppose, removing barriers to enabling more people to enter the health educator workforce.
um, I think, it's when we talk about decolonizing, there's so much layers to it. And one of it is, who do we use to advertise? Let's start with if students should be saying, if you have a really good student council and a student union, when jobs are being advertised in healthcare professions, the student union and student councils or student representatives should be saying, where are you advertising them? They should be asking those questions. You need to be politically astute and say, so, are you advertising, for example, I am Black from the Caribbean, I read the Voice newspaper. Are you advertising in the Voice? Um, my colleague, Professor Roxanne Crosby now will be at Moorfields. She goes on the Asian radio stations and does a lot of stuff around ophthalmic health and eye care because that's the community she wants to reach that's most underrepresented and underserved. So I guess as students, what can you do? One, gather yourself to become political. You need to become more politically astute and aware and say to your dean, look, when you're making decisions, not just about the appointment, it starts before the appointment. Where are you advertising? How can we be part of that? Why can we not get a couple of students to say, this job is being advertised, blah, 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 and you put it out on social media with a link. So you have to be really astute. And I think that's some way students can participate. You can also then be on the shortlisting and interview panels. Those things are really important. Do not for one moment underestimate and do not get intimidated if you're invited to a panel because you see all the professors and all the doctors and all the senior lecturers and whoever else sitting there around the table to interview, and you feel your voice doesn't count. This is when you need to make your voice count, okay? So try and learn, find out from your organization how you can participate in these things. If they have a race equality charter, if they have an Athena Swan charter, they would have these things as, goals set out to do. So you'll also be helping them, I think.
Thank you, Calvin.
Uh,
Just on that point, I don't know if you'd agree. I agree with what you've just said, but do you think it's also important for everybody to be much more self-aware? I'm reflecting back to, the idea you've raised about that hierarchy, and people can see others as inferior, even though they look exactly the same because of that hierarchy. And unless everyone is much more self-aware, it creates a barrier.
Yes, I agree. So it's almost that flattening of the hierarchies that need to happen. And we become, because what you want is the best person for the job at the end of the day as well.
Absolutely. Thank you. Got one comment rather than a question, and then I'll come on to a question. But someone said they couldn't agree more. Currently, they're decolonising the curriculum in midwifery, and all of the issues that you've mentioned have been raised and they're starting to be addressed. So that's positive that they're starting to be addressed.
Yeah, that's really good.
Okay. Another really important question. How do you open the eyes of white colleagues to the presence and dangers of whiteness without causing offence? And the individual says they've read White Fragility and other similar texts, but still have fellow health lecturers who quickly become offended and disengaged when they try to raise issues.
This is really, it's important and it's difficult. So congratulations and well done on reading the text because we say to people, it's your job to read. It's not my job to tell you how to fix it as such. And you would see that in why I'm not talking to white people, probably one of the texts this person have read. Um, how do you open their eyes? Um, you can start by having, again, creating some sort of group in your workplace, so you might not want to call it anti-racist group. Just if people are harsh, if they're resistant to terminology, you might have to find the right terminology. But in your head, you're thinking, look, I want to do an anti-racist group in the on the ward or the unit or whatever it is. So I think that's one way to start. So you can build a group. So then it's not just you alone raising, your voice. There are other people with you, and so there's, unity and or strength in unity as such, as we say. Um, it's not about causing offense. You may make people feel uncomfortable. And a lot of the time, some people in this lecture right now would have probably felt uncomfortable when I started to talk about whiteness. It's not a one day I'm gonna wake up and say, I'm anti-racist. Yes, you wake up and you say you're anti-racist, but the journey to becoming anti-racist is longer and it takes time. You will make mistakes along the way. Those things will happen, you own them, but they become you know, learning bites for us as such. And I think um it's not about offending you, but people will become uncomfortable. Um, someone said to me, met me recently, and I said, "Oh, all you ever talk about is race." And I smiled and I said to her, "Why should I not? Tell me three reasons why I shouldn't talk about race." And she couldn't, you know. But so you might be labeled. That's what I'm trying to say. But hold true to what you believe. You know, I say to people, not all white people are bad. It's the system. That's why I call it systemic whiteness, structural whiteness. Some of these things you yourself probably didn't realize that, it's whiteness that, created these divisions among us and told us how we should think of, a lot of people, when you see, they talk, they see a black man on the street and they think he's going to steal their handbag, right? We know those things. They really happen. That's because this is what whiteness told us. People are different in that sense, the negativities. So, good luck with it. I would say start by a group, connect with if you're on placement or if you're in the university either, or connect with their EDI groups there. They will have some sort of support for you and they should be able to give you tips as well. Okay.
Thank you. We've got about 5 minutes, and I've got a couple more questions.
So,
One of the questions is, apart from role modeling that we've spoken about, is there a role for sponsorship?
oh yeah, there's a big role for sponsorship. So, I have my sponsor at the university. It's a white woman. I know exactly when I'm doing things who I'll go to and speak to because she sponsors me. She will get my idea into the university executive boardroom. Okay, so sponsorship are really important. They hold the door open for people when really and truly we can't even unlock the door. They don't just unlock the door, but they hold it open for you. So I think it really is important. And everyone should try and find a sponsor.
Yeah. And on a related note, what strategies can we use to ensure more people of colour can get professorship?
So there are various programs. Okay, now, so for example, there is the now 24, no, 100 professors now, sorry. So there's a 100 professors now program, which is a program to get Black women into professorships. So that's really important. And so people can apply for that. So it's an accelerated program that they tell you when you come in within a year, we should be able to help you get to your professorship. So there are programs around like that. The Americans have a program called Doctors of Color, or DPNs, doctoral nurses of color. So there are various schemes around. So and I should say, just say, I am looking at getting some funding around this whole thing of professorships as well, of how we create that networking environment first, and then how we tell people it's like, it's not until someone took my CV and sat down and said, this is how you write a CV. I'll tell you all really quickly. When I applied for my professorship, I didn't like most things, which is really something you don't tell everyone. And one of the white women who was a professor here, quite, aged in terms of professorship, she saw me in the corridor and she said, "Oh, you've got what it takes, but you probably need to look at the mechanics of your application. It's the mechanics of your application form and CV." But that's all she left me with. Professor Bertha Ochieng at De Montfort in Leicester said, "My brother," Bertha is Kenyan, she said, "My brother, come, let's sit down. I will show you how to do a professorial CV." So there's something about community that we will show each other. The white woman just told me, "You got to learn the mechanics of the form." The other person said to me, "Come, spend the day with me in De Montfort, Leicester." I ended up spending 2 days on the trot with her, but we got it right. And here I am. So I think there's always also something in community. I would say to that person, also find your giants. Your giants are really important. So that whole thing, talk about sponsorship, role modeling, and start mixing in professorial company. When you mix with professors, you learn how professors speak, how professors think, and how they act. So you need to start being in that community and learning from professors as well.
Absolutely. On a related note, and I think we've gone through all the questions, but just one further question from myself, which you've already started to touch on, which is how do you address some of the issues that are at an institutional level that discriminate or disadvantage certain people, and how do you deal with those institutional level issues?
So I would like to think that most organizations who have got a race equality charter are working towards one. As I said, the same for Stonewall charter marks, etc. So that's one thing. If they've got those charter marks, it means they have to now do the work to make it more equitable. And I think one of the things about discrimination is if you invite me into your house, you should be able to make me feel comfortable in your house. So if you've offered me a job in your organization, I should be catered for. And I think sometimes us as minoritized people, and I say minoritized, not just racially, all the other, groups that can discriminate against age, etc. As minoritized groups, sometimes we just sit back and accept it rather
Thank
than say
you.
to the organization, hold on, I am here. What are you going to do about me? So there are policies. There's, apart from going down the union route, I think there are roles for EDI representatives within the organization or within your faculty. Start it. Listen, I started things off my own back here in my faculty. I wanted to have a writing and publication group. I started it off. I just went to the dean and I said, I'm doing this. I got some clearance and such. So if you want to do those things, look at those strategies that you yourself can start developing in-house. The best thing is to form a group with a few people, start sharing the idea, and then you kind of bring it into fruition.
Thank you. Calvin, we've only got time for one more question, but there's a question about what are your tips for getting a sponsor? And I think you've started to touch on that already, but I'll ask the question.
So your tips for getting a sponsor, decide who you want to be your sponsor. And the easiest thing, reach out to that person and say, hi, I know you might be really busy, blah, 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 but I would like. And what you say to them at the end, if you can't do it, can you recommend somebody who might be able to? And that's how it will start you going. That's the biggest tip. Reach out to the person. Tell them, you don't need to be over flattering. Just say to them, I really am, and I would really like to, and I think you'd be ideal. And if you haven't got the capacity, can you recommend me to someone else? And sometimes that person inbox might be so busy. If you don't hear from them for 2 or 3 weeks, send them another follow-up email. Just to,
Thank you.
to say, sure.
Calvin, thank you. And thank you so much for the presentation and talking us through that this afternoon. It's been a really important topic, and I've certainly enjoyed listening to you, and I'm sure everyone else has. Can I say thank you to the audience for joining us this afternoon? It is now 4 o'clock, so we do need to bring the webinar to a close, but thank you ever so much for attending this afternoon.